The pericoronitis can be defined as the inflammation of the gingiva in relation to the crown of incompletely erupted tooth. So pericoronitis is also part of acute gingival infections. I have made separate videos about necrotizing ulcerative gingivitis, primary herpetic gingivostomatitis, and in this today's video I will be discussing specifically pericoronitis. So pericoronitis can be classified as acute, subacute, or chronic. Most of the time pericoronitis is seen in mandibular third molar region. And clinically pericoronitis presents as a red, swollen, and sprouting lesion that is tender with radiating pain towards the ear, throat, and floor of the mouth. And patients have foul taste, and patients are unable to close their mouth. Along with these symptoms, patients also have swelling on the cheek. Trismus may also be presenting complaint, and also systemic complications such as fever, leukocytosis, and malaise. So this is the clinical picture showing inflamed coronal flap covering the disto-occlusal surface of impacted mandibular third molar. You can see there is redness and swelling in it. Now let's talk about the treatment, which depends on following three factors. Number one is the severity of inflammation, the systemic complication, and the tooth retainability. So I have another picture which is about the treatment of pericoronitis. You can see in this picture there are A, B, C, D, and E diagrams made. So in A and B there is a pericoronal flap covering partially erupted third molar. In picture C and D, flap is reflected with the help of scalar, and then underlying debris is cleaned. And in picture E, there is a wedge-shaped incision made to the tissue. The treatment of pericoronitis completes in 2 visits. In the first visit, we use warm water and topical anesthesia. Then the flap is reflected with the scalar. And underlying debris is also removed. Then we have to give instruction about rinses and ask the patient to take the copious amount of fluid. And also systemic antibiotics are prescribed. Then we have to check if the flap is swollen or fluctuant. If yes, then an anterior-posterior incision with a number 15 barred Parker blade to establish drainage, followed by insertion of 1/4 inch gauze wick. Then we move towards the second visit. Now we have to make determination whether it is okay to retain the tooth or just extract the tooth. And that's the end of this video. If you guys have any questions regarding this, please leave them in the comment section. I will be replying them. Subscribe Smart K3 Dentistry for more dentistry related videos. Thanks for watching. See you guys in the next video.